Welcome to this episode of Orthodontics in Summary. Today's lecture is entitled Dental Sleep Medicine and NICE Guidelines. Now this lecture was delivered by Professor Ama Johal, who's also an advisory member of the same NICE committee of the guidelines. Now as always, the podcast is the opinion piece of myself and may not be 100% representative of the lecture. It is the independent work of myself and the Orthodontics in Summary team. So back to the lecture. So Ama started off by describing what obstructive sleep apnea is, and it is essentially a sleep-related breathing disorder. It has been and still is poorly understood in both medicine and dentistry. What we do know is that 70% of the airway collapse takes place in the retroglossal area, so the area just behind the tongue. Patients in this condition essentially stop breathing. During that process, the body tries to wake up the patient. In that process, the body will make certain movements and it will cause a disturbance to the sleep. Now, the health consequences of obstructive sleep apnea are pretty significant. They can cause daytime sleepiness, but also other health conditions such as hypertension, heart disease, stroke. In fact, all stroke patients are now screened for obstructive sleep apnea. So what are the treatments available for obstructive sleep apnea? Now this actually made up the majority of Ama's lecture. So when it comes to the severe and moderate sleep apnea, the gold standard is continuous positive airway pressure, or CPAP. So what is that? Well, essentially it's filtered air and it's pushed at a high pressure through a mask into the patient's mouth and lungs. Now to be effective, it has to be used for 4 to 6 hours and 7 days a week. It doesn't cure the condition, most importantly, it is just to manage the symptoms for the patient. When it comes to compliance of it, it is poor, around the 30% mark. So this brings us on to the NICE guidelines from 2021 entitled Obstructive Sleep Apnea Hypopnea Syndrome, which Ama Johal was involved in producing. So in those guidelines, it describes CPAP, continuous positive airway pressure, as the gold standard for symptomatic patients. If they aren't compliant, then patients can be provided with a mandibular advancement splint. And this really then falls into more of the dental realm. The requirements from the guidelines are for patients to have good dental and periodontal health and to be above the age of 18. So what is a mandibular advancement splint appliance? Well, essentially it's an appliance which increases the anatomical area for the pharyngeal airway. Now, it's got 3 main modes of action. The first is that it brings the mandible and the tongue forwards. As we mentioned earlier on, 70% of patients with obstructive sleep apnea have a collapse in the retrolingual region. Next, it reduces the airway collapsibility, and the third mode of action is a physiological role. It actually stimulates the dilation of the upper airway muscles, improving the strength and keeping the airway open. In those same guidelines, there's a description of 2 different types of mandibular advancement splints, that of the semi-customized and that of the customized. Essentially, the semi-customized are ones that are purchased from Amazon or somewhere else, where they can be heated or boiled and remolded to the patient's teeth. It doesn't involve a clinician. And the customized version, the one which is created and formed by a clinician. Now, there are differences between these two, which Ama Johal has contributed to the literature in his systematic review in 2018. And essentially, the summary findings from that systematic review were that it is overall better to have a customized mandibular advancement splint relative to a semi-customized splint. The improvements for the indexes for obstructive sleep apnea are better with a customized appliance at the units of 3 for the AHI index. Daytime sleepiness is better, but also patients report better wear with a customized appliance, wearing it for almost 7 nights a week compared to 3 nights a week for the semi-customized appliance. Patients also had a preference of 95% for the customized appliance. Now, Ama went and explored the design features of a mandibular advancement splint. The main feature is that they have to be well retentive. He mentioned how they can have incremental increases to their advancement as patients start to use them. He mentioned how allowing for full coverage to take place with the appliance is key, but also minimal vertical opening. And he mentioned caution to be taken here. If a high-angle case has a mandibular advancement splint with large vertical opening, there's a clockwise rotation that occurs. This can compress the post-palatal area, resulting in a compression to that region, means that there's going to be far less opening of the pharyngeal airway space and actually enhance the disease rather than the resolution to it. When it comes to long-term follow-up of patients wearing these advancement splints, what do we see? Well, there's some dental changes that occur, as we would expect. There's mesial molar movement that takes place in the mandible. There's also a reduction in the overjet and overbite of approximately 1 mm, as well as proclination of those lower incisors. So it's not without its dental consequences. In conclusion, Ama Johal's lecture had looked at the new NICE guidelines, which showed good collaboration between medicine and dentistry in exploring this health disorder. He spoke about different appliances which are available and really had an emphasis on the customized appliance being ideal for patients. He also mentioned how poorly understood some of these processes are, and we need to work towards getting better answers for our patients, but also establishing pathways for them to be able to access this health resource. I'd like to thank the sponsors for the podcast today, who have been O Laboratories, OrthoCare, and also the Aligner Intensive Fellowship. And as always, please do subscribe and look forward to the next episode.